Good morning, guys. A very good morning to everyone who's watching this video. I'm Shekhar Tiwari, and this is the series I've been planning for you, which will be very helpful to all the upcoming NEET, PG, and FMG aspirants. So, this is my mixed bag MCQ discussion episode 1, and I will make sure to come up with several other episodes in this series. And here we are going to uh, discuss quickly 5 MCQs that I recently posted on our Telegram channel. So if you have not joined our Telegram channel yet, I would ask you to join the channel. The link would be provided in the description below. So let's get started. The first question is from general pathology. So the question says, a cell suffers from injurious stimuli and undergoes reversible cell injury. See, reversible injury. This is a pretty straightforward giveaway. They are letting you know that it is a reversible cell injury. What they could have done is they could have given you features of reversible cell injury, and then you would have to figure out on your own that it's a reversible cell injury. But here they have given us that it's a reversible cell injury. All of the given below statements are true except. See, whenever such questions come, true, except, false, except, you need to take a deep breath and you need to read properly and figure out what they are asking. So here they are asking us which of the following is a false statement for reversible cell injury. So these are the options: hydropic change, large flocculent mitochondrial densities, decreased oxidative phosphorylation, and clumping of chromatin. So let's start with our discussion. As we all know, cellular injury, the most common cause of cellular injury is hypoxia. Sorry, guys, I'm still not used to using this one. Hypoxia. I hope you understand what I'm writing. And then reversible cell injury. Cellular injury are of two types, reversible and irreversible. So in reversible cellular injury, the earliest manifestation is cellular swelling. Cellular swelling is also called as hydropic change. The cell is filled with water. And then you can also in reversible cellular injury, you can also notice mitochondrial swelling, because of which there is decrease in ATP, which can also be called as decreased oxidative phosphorylation. So that was one of the options. Even the hydropic change was one of the options. And irreversible cellular injury is caused because of permanent damage to your calcium magnesium pump, which will cause increased influx of calcium ions inside your cell, and due to which there would be deposits in the mitochondria, and these deposits are of following characteristics. They are said to be amorphous in nature, they are large in size, and they are also sometimes referred to as flocculent densities. And as we all know, these deposits in mitochondria, they are the most characteristic feature, as I've written here, most characteristic feature of your irreversible cellular injury. So the correct answer to this question should be option B. Let's move on to the next question. Now this one is a gynecology question. Uh, a couple presents to the IVF clinic with complaints of infertility. On investigation, male partner was found to be suffering from hypergonadotropic hypogonadism. Which of the following will be the most likely lab values? So option A says both LH and FSH would be high. Option B says only LH, both LH and FSH would be low. Option C says decreased LH and high FSH, and option D says low FSH, low testosterone. So this question is mainly talking about the male infertility. For discussion of female infertility, I would come up with a new video. Another question. We'll discuss this next time. So here, as we all know, in male infertility, there are three causes. They are mainly testicular cause, and post-testicular cause. If it's a pre-testicular cause, both FSH and LH decrease. If it's a testicular cause, testosterone decreases, but FSH and LH increase. And this is due to negative feedback. And in post-testicular cause, which is due to any pathway, obstructive etiology, uh, FSH, LH, and your testosterone remains normal. So, as we all know, hypogonadism is a pre-testicular cause. So, in pre-testicular cause, FSH and LH should decrease. And talking about hypogonadism, we have either it can be hypergonadotropic hypogonadism or hypogonadotropic hypogonadism. So, if it's hypergonadotropic hypogonadism, the FSH and LH value will raise. But if it's hypogonadotropic hypogonadism, the FSH and LH values will decrease. So the correct answer in this question should be option B, low LH and low FSH, because they are talking about hypergonadotropic. I'm sorry, it should be hypogonadotropic. So in case of hypogonadotropic hypogonadism, LH and FSH values should decrease. And if they ask you for hypergonadotropic, then the option A would be the correct answer. So sorry, that was a mistake on my side. I'm sure you get the concept that I'm discussing. Let's move on to the next question. Next question is from pathology, and a child was brought. The question goes as a child was brought to the OPD with complaints of self-mutilation behavior. Lab findings shows elevated uric acid levels, which is the appropriate statement about the mode of inheritance. So see, this is really very straightforward. It's pretty much a giveaway. If you are done with your first reading of biochemistry, I'm sure you must have come up with a perfect provisional diagnosis already. So the provisional diagnosis in this question is Lesch-Nyhan syndrome, because there is increased uric acid levels, and wherever you read this one, self-mutilation behavior, the only diagnosis that you should come to your mind should be Lesch-Nyhan. And also, uh, the provisional diagnosis goes as Lesch-Nyhan syndrome, and which follows X-linked recessive mode of inheritance. So the answer to this question should be X-linked recessive. And this topic is the examiner's favorite. They generally ask you one or two questions from the mode of inheritance. So I'm sure you must have known we have various mnemonics. As I think there is one mnemonic which goes as Ravi, which is for X-linked dominant diseases, and we have a mnemonic. Uh, he has a dominant father, and this is mnemonic for autosomal dominant diseases. So in my Telegram channel, I will post a picture of the mnemonic and what the mnemonic stands for examples of all the mode of inheritance. So make sure you stick to my channel. Let's discuss the next question now. This is the second last question. So the question goes, it's from ENT, and the question goes, a 68-year-old diabetic male presents with persistent earache. So I'll just highlight the pertinent points for you. 68-year-old diabetic presents with persistent ear discharge. Uh, he complains of pain out of proportion on examination, granulations. See, this is very important. Granulations and tenderness are observed on the floor of external auditory canal, along with facial nerve palsy. Facial nerve palsy. He is not responding to antibiotics. What is the most probable diagnosis? So, as we all know, as it's taught to us by our ENT legend, Dr. Rajiv Dhawan, whenever you come across a question of an elderly male, elderly may be it male or female, uh, diabetic patient, and there is headache, fever, and there is granulations in the external auditory canal in the ear, your provisional diagnosis should be malignant otitis externa. So, provisional diagnosis here is malignant otitis externa. See, guys, ENT should not be, overlooked. ENT is a very scoring subject. ENT is the subject which will come through for you in your paper too. And if you manage to score well above 70% in your ENT questions, then it means that you're on your good path. And ENT, they don't have a lot of topics. They just have a few hand selected topics around which they generally ask you the questions. So don't ignore your ENT. So the correct answer here right away is malignant otitis externa. I have few points about otomycosis I would like to discuss. Otomycosis is a fungal infection of your external ear. The etiology behind it is a fungus called as Aspergillus niger, and it leaves behind a very characteristic wet newspaper appearance. So yeah, that was all about this question. Now let's move on to the last question, which is pretty straightforward, pretty basic, and I'm sure a lot of you would not do mistake in this one. So this question is asking us which of the it's from pharmacology. Which of the following is the action of dopamine at low doses? So low doses. This is a very key word here. The option goes as it increases renal blood flow, it has positive chronotropic action, it causes vasoconstriction, and it causes hypotension. So, as we all know, dopamine, it is a natural catecholamine, and it is derived from tyrosine, amino acid tyrosine. And dopamine has three effects at three concentration. So, at low concentration of 2 microgram per kg, it acts on the D1 receptors. At concentration from 2 to 10 microgram per kg, it acts on beta 1 receptors, which is present in your heart. Sorry, pardon my drawing. And it has a positive chronotropic effect, which basically means it increases your heart rate. And at doses about 10 microgram per kg, it acts on alpha 1 receptors. Alpha 1 receptors are present in your vascular smooth muscle, and it causes vasoconstriction here. So, our question is asking us at low doses, what does dopamine do at low doses? So, at low doses, it acts on D1 receptors, and it causes decrease in your renal blood flow. Increase in your renal blood flow. So, the correct answer here is option A. increase in renal blood flow. The chronotropic action would be in doses of 2 to 10 microgram per kg, and vasoconstriction would be in doses more than 10 microgram per kg. And as we all notice that at 2 to 10 it's chronotropic, so I want to discuss with you what is ionotropes. Ionotropes are the drugs which increase contractility of the heart, and example for this is dobutamine, digoxin even. These are your ionotropic drugs. So yeah, that was about it. That was about my discussion of the 5 questions. I will come up with more questions and another discussion video, episode 2, following. Thank you so much for watching my video. If you liked my video, I would ask you to like, comment, share, and subscribe. And you can request anything, any content that you would want to watch in the upcoming videos. Thank you so much.